In 2021, the stillbirth rate for Black women in Iowa was 3 times more than any other race within the state. Larissa Leone sat down with 2 organizations working to help Black mothers overcome those odds.
Stephanie, a stillbirth is defined as a loss of a baby at 20 weeks or greater. And we lose anywhere from 150 to 175 babies every year in Iowa to stillbirths. Black expecting parents are 2 times more likely to endure the tragedy of a stillbirth compared to white expecting parents. Those startling statistics are why 2 organizations are working to improve.
The stillbirth rate for Black women in Iowa was about 3 times more than any other race or ethnicity in the state.
Jackie Easley is the Diversity, Equity, and Inclusion Director for MercyOne. She says her team is efforting research and resources to help support Black mothers.
Rather than attend webinars and hear more research, we decided to be proactive.
MercyOne is partnering with Count the Kicks, an organization working to improve birth outcomes. Health Equity Director Jody Long says Count the Kicks focuses specifically on preventable stillbirths.
When we're talking about healthcare and birth outcomes, we're finding that women of color aren't often listened to in places of where they receive their care. And so that's our job, is to make sure that those who are working with patients of color in the healthcare system make sure that they are listening to their patients.
Long says Black women have access to fewer resources than white women when it comes to maternal health.
People of color are using the emergency room and the emergency department as a source of primary care 30 to 40% more than white women.
With MercyOne's help, Count the Kicks is piloting a program that will look at existing barriers in Iowa and then create a patient connection protocol within the hospital. The protocol will help connect patients to a primary care provider, an obstetrician, or a midwife to make sure they're getting the care they need.
And the reason why this is so important is the fact that we're catching these expectant parents, these pregnant people, at a time when it's not too late.
Jody Long says Iowa's stillbirth rate decreased by 32% during the first 10 years of the Count the Kicks campaign. An amazing accomplishment, but Long says the work can't stop here.